Mr. Ritchie, his GAC's oversight report pointed to structural incentives in Obamacare and Medicaid expansion for states to enroll as many people on the program as possible. The report cites the ACA state reimbursement formula, which is driven by the number of enrollees, and Medicaid's 100% cost coverage in the first 3 years. Do you agree with the report's assessment that these financial incentives may result in states adding people to Medicaid who don't truly meet eligibility requirements?
Yeah, we haven't done anything looking at the incentive, but I would say we've done the recent eligibility reports that we mentioned in our testimony that I mentioned earlier. And with those eligibility reports, we found that people were certainly enrolled that were not eligible, so there's a concern there. We also, with the increased 100% FMAP, or federal matching funds, we've done, this isn't the first time that Medicaid's been set up where they've paid at one level for a service versus another level, and we've had a history of work where we've looked to see have the payments been appropriate, and we've seen where they've offered those increased payments. There have been inappropriate payments where things have been submitted at the higher level versus the other level, so it certainly in the past has shown work where an increased federal participation has led to improper payments. So from our perspective, we follow a risk assessment. We see that there's certainly risk there. And from an eligibility perspective, regardless of the policy decision of whether it's 100% of federal poverty level or 138%, we think the rules need to be followed, the right beneficiaries need to be enrolled, and that's clearly not happening right now.